Welcome to the Plans of Safe Care training for community providers. I'm Beth Van Horn, one of the members of the team who helped develop and pilot test the Plan of Safe Care. This training is intended to serve as an overview training module explaining why the Plan of Safe Care was created, the target populations it was meant to serve, and who should be involved in developing and updating plans of safe care with families. Additional modules providing a walkthrough of the materials, implementation guidance, additional resources, and exemplar videos will also be made available. All levels of service providers who work with pregnant and postpartum women, including but not limited to treatment providers, recovery coaches, social workers, case managers, pediatricians, obstetricians, child welfare workers, nurses, prevention staff, etc., are all welcome and encouraged to attend this training. By the end of this training, you will be able to explain why the Plan of Safe Care was created, understand CAPTA and CARA legislation requiring plans of safe care, and explain the purpose of the Plan of Safe Care and who should be involved. Parental substance use is a well-known, recognized, and long-standing adverse childhood experience. Children exposed prenatally and in their home environments are more likely to experience numerous short and long-term adverse outcomes. Studies have shown children exposed to substances have increased rates of physical, mental, and behavioral problems, developmental delays, substance use disorders in adolescence and later life, child maltreatment, and entry into the foster system as compared to their non-exposed peers. In fiscal year 2019, 34% of all children in foster care in the US had parental substance use listed as a risk factor for removal. In Texas, this percentage was well over 60%. Not only do children suffer, but women and mothers with substance use issues and disorders can also experience negative outcomes. Over the last 2 decades, the number of women with substance use disorders has increased, most likely due to the general increase of opioid use and abuse. While the most extreme consequence, death, has been rising in both men and women, as of 2020, women were outpacing men. And sadly, in a review of maternal deaths in Texas, drug overdose was found to be the leading cause of maternal mortality, with all of the overdose deaths reviewed occurring after birth. Given these statistics and the national attention the opioid crisis has received, there seems to finally be a growing consensus that something must be done, that intervening at or after birth is just too late. No longer can our response be wait till birth and call child welfare. We must seize the window of opportunity that pregnancy and the postpartum period provides in terms of women wanting to make healthier choices for their babies and their families, and in terms of our increased interactions that many of us are having with pregnant and postpartum women. Luckily for us, federal legislation has been issued and guidance has been given to provide a framework for how providers can increase support and coordination of care for pregnant and postpartum women with substance use issues. The Child Abuse Prevention and Treatment Act, referred to as CAPTA, was created to bring a federal focus on prevention, identification, and treatment for child abuse. CAPTA provides states with federal funding and guidance to improve their child welfare systems and their prevention activities. Over the years, amendments have been made to CAPTA that have added and changed the state's requirements related to substance use. In 2003, CAPTA added a requirement that each state provide an assurance that the state had policies and procedures to address the needs of substance-exposed infants, including requirements to make appropriate referrals to child welfare and other appropriate services, and a requirement to develop a plan of safe care for affected infants. However, at this time, there was little guidance around what a plan of safe care was and what it needed to include. In 2016, the Comprehensive Addiction and Recovery Act, CARA, was enacted, which amended CAPTA and removed the term illegal as it applied to substance abuse affecting infants. And it specifically required that plans of safe care address the needs of both infants and their families, really underscoring the importance of family health and well-being on the role of the developing child. CARA also added requirements related to data collection and monitoring. States are now required, to the maximum extent possible, to report the number of infants identified as substance exposed, the number of such infants for whom a plan of safe care was developed, the number of such infants for whom referrals were made to appropriate services, including services for affected family and caregivers. Since late 2019, a cross-disciplinary team in Houston, Texas, has been working to create a plan of safe care and portfolio, including documents and resources needed to help support moms, infants, and families experiencing substance use issues or with a history of substance abuse. The portfolio and documents have been piloted, and feedback from providers and mothers were used to improve the documents and the process. So what is a plan of safe care? The Plan of Safe Care is a tool designed to support pregnant women and families at risk for or experiencing substance use issues. It includes documents and resources mothers and their families complete with their care providers. This includes information on the mother, the infant, and the family's support system to help the family and their providers with care coordination and increase the ability of mom to advocate for her needs and the needs of her infant and family. The goal of a plan of safe care is to strengthen the family, help mothers have a healthy pregnancy, and keep children safely at home. By utilizing this tool, families can demonstrate the progress they are making in their recovery, the preparations they have made to provide a safe and stable home, and the supports they have in place. The Plan of Safe Care can also be looked at as a personalized guide to ensure the necessary resources are provided to help families thrive, a recovery resume that helps moms communicate all the work and preparations they have done, and a guide to promote health and safety for mothers and babies. By using the Plan of Safe Care, moms and families can really demonstrate the progress they are making in their recovery and the steps they have been taking to ensure that they have a safe and stable home for their baby. So the original and primary target population for the use of plans of safe care is with pregnant women and families with infants who are at risk for or have experienced prenatal substance exposure. However, through our pilot, many of our providers acknowledge that using these documents and this framework for care coordination could be beneficial for many groups, especially those with current or prior experience with child welfare, domestic violence, incarceration, or homelessness. It is our recommendation that when in doubt, offer the help. There are no strict exclusion criteria set forth by the federal legislation or within our state. Please note, though, that if you use the documents with other populations who do not misuse or abuse drugs or alcohol, you may need to tweak the language in some of the documents to better fit the population you're working with. In terms of when you should use a plan of safe care and when it should be initiated, ideally the plan should be developed during pregnancy, really as early as possible. This will allow mom and the infant to get the most benefit from the services. However, we realize this will not be the case for all moms and families. If it cannot be developed during pregnancy, it should be completed after delivery but before leaving the hospital. We don't want to lose the opportunity to connect the mom and family with the needed services and resources. A key component of creating a plan of safe care is really early intervention. This can help moms access treatment and supports that they need, and it helps moms and families create and think about a plan for after the baby is born. A plan of safe care should include input from all service providers involved in the mom's care and the care of their baby. This could include healthcare providers, counselors, substance use treatment providers, faith leaders, case managers, social workers, mental health providers, and recovery coaches. Really, anyone that the mom trusts and is knowledgeable about the mom and the family can help her complete this plan. Take note that there are no requirements for who has to be involved other than the mother. Mothers should be encouraged to share it with her providers, but it is her portfolio and she needs to be comfortable with whom she shares it with. A few frequently asked questions that we encountered during our pilot. So who runs this program? Where do I send moms to get this? So the Plan of Safe Care is a tool. There is no owner. All organizations and providers working with pregnant and postpartum women can and should help families start and initiate their Plan of Safe Care portfolio. What about dads? Dads and partners can absolutely be included. We encourage you to encourage dads and partners to save their accomplishments and documentation in the same binder as the mom, or to create their own binder to demonstrate their progress and accomplishments. Can a Plan of Safe Care be created for someone who is not at risk for or experiencing prenatal substance exposure? At the end of the day, this is a tool. If you believe that moms and families could benefit from it, use it. Is there an age limit on who can get a Plan of Safe Care? Is it only for those who are pregnant or with infants? Now, moms and families will get the most benefit from using a Plan of Safe Care if they start early and use it throughout their pregnancy and while the infant's young. However, during our pilot, our providers recognized that moms who had older children could also benefit. In these instances, the providers adapted the resources to make them better fit the family they were working with. And finally, how does the Plan of Safe Care help? Using a Plan of Safe Care can help families in many ways. It can help them identify their needs, demonstrate their progress and accomplishments, keep their documents and notes organized, and communicate with their providers. This tool may be especially helpful for families who are engaged in multiple systems of care at one time, and for families with a high likelihood of child welfare involvement. A few quotes from our pilot providers and mothers. Plan of Safe Care saved me. I had a previous CPS case with my 2-year-old, so I knew they would be checking on me. My caseworker was so impressed. They were impressed I was organized. I really needed this. I can present this to my new CPS worker and show the progress I am making in my recovery. This plan is giving them, moms, empowerment. If you have questions, comments, would like to hear more about the creation and development of the Plans to Safe Care, or would like to obtain copies of the brochures or documents, please contact Andrea Rincones or myself at the addresses listed on the screen. Thank you so much for your time and attention, and we hope the Plans of Safe Care can help you support your pregnant and parenting mommies and families.